Okay, hello everyone, and thank you so much for joining. My name is Maytal Weiss, and I'm a Director of Business Development at the FreeMind Group. Today we'll be talking about biodefense and infectious diseases funding opportunities. The slide deck is available at the handout section within this very sophisticated system. So feel free to download it as we're done or now. And I'll be very happy to talk a bit about the different opportunities out there. But maybe before we do that, maybe just a few words on who we are. So FreeMind is a consulting firm. We've been active for about 20 years now. We have 70 full-time employees and a very diverse client base. We work with academics, university medical centers, independent research institutes, and the industry. Anything from very early stage startups all the way up to big pharmaceutical companies. And we submit around 500 applications annually. So we feel that we have a pretty good grasp in terms of the different trends within the non-dilutive funding landscape. And in terms of how we see ourselves, we try and be a tool to help our clients maximize their funding potential. After quite a few years of doing this, we know that among the most important elements are, first of all, identifying the most relevant funding opportunities for you, strategizing and maximizing the application's chances of success, managing complex project production processes, leading the joint application writing, and supporting the final contract negotiations. And basically, we look at non-dilutive funding as a very strategic financial tool. And if we zoom into the NIH's budget, and this is just an example because most of the non-dilutive funding comes from within the NIH. So within the $37 billion they have, a very big portion goes out to fund research projects. And we're talking $28 billion, definitely a lot. So we'll start with zooming on the NIH. And one of the largest institutes within the NIH is NIAID, the National Institute of Allergy and Infectious Diseases. And if you look at the budget of NIAID from 2014 to now, you can see that there is an increase. And the reason for that is definitely the US government making sure that we understand that fighting infectious diseases, basically making sure that they are able to help companies, researchers, universities use these topics and basically leverage their research on top of that. And basically, we're talking about over $5 billion for infectious diseases, for biodefense, another almost $2 billion for biodefense. And NIAID, in addition to having a very, very significant amount of money to give away, they also have a very good success rate. Meaning, if you're submitting an application to NIAID, you are more likely to be selected and funded compared to other agencies. Just as an example, the National Cancer Institute has a success rate of about 5% for some mechanisms, and even less than that. So NIAID is definitely a very good place to submit to. Obviously, if you're compliant with what they're looking for, and we'll definitely go into that in a minute. But my point here is that it makes a lot of sense to submit to NIAID, to the NIH, if you are within their scope. And in terms of the mission of NIAID, or the things that they are looking to fund, or bugs of interest, first of all, they're looking for newly appeared in the population or existed but rapidly increasing, or caused by one of NIAID's category A, B, or C priority pathogens. And I added just a few examples. So with A, we have anthrax, we have Ebola, quite a few of these, dengue. With B, again, we have hepatitis C, we have salmonella, West Nile virus. With C, we have yellow fever, influenza is definitely there, chikungunya, SARS, and definitely, there are many more, and I included a few examples. But I also included the link to their website. You can see it at the bottom of the slide. Make sure that the bug that you're working on is within their list, and you'll be surprised. It's a pretty long list. So in terms of the different funding rounds that we see, and this is of course not only limited to the NIH, but generally speaking, if we think about the different funding rounds within the sources that we target, we like to divide them to three. The first type of opportunity is the solicited funding opportunity, where you'll go into the website, you'll see a link, and it's going to say, pandemic influenza, and this is exactly what you're doing, and they're describing exactly what you want, and you go out and you submit to that, and that's obviously the simplest example. But the second one, which is very important to mention, is the unsolicited funding opportunity. And unsolicited basically means investigator-initiated opportunity, meaning you do not find a paragraph describing exactly what you do, but the NIH and many of the other agencies, they took a slightly different route, saying, okay, we are interested in this topic in general, but we don't want to go into the specifics to not box you in a certain amount of indications that we thought of. Please pitch your idea to us. We'll route that internally, have it reviewed by the most appropriate group of reviewers looking through these applications. And then if we feel that this is something that could be beneficial, we'll be very happy to award it. The trick with the unsolicited opportunities is that you have to know what you're looking for. If you'll go into the NIH website, you'll find more than 1,000 hits. But most of the money allocated by the NIH actually go out through these investigator-initiated opportunities. These include the R21, the R01, and the SBIRs, and many other of them. So definitely make sure that you understand that there are different type of opportunities out there as well. And the third option is the broad agency announcements, or the BAAs, and they are more typical to Army, BARDA, and other agencies that are not specifically the NIH, and we'll go into that in a minute. So if we're starting with the NIH, the National Institutes of Health, we definitely would like to divide the examples that we'll be showing into two different groups. The first group is called the preclinical funding, which is basically more initial stage research. So the first one that I would like to present is Countermeasures against Chemical Threats, or CounterACTs, identification of therapeutic lead compounds, and this is the U01 mechanism. I also added the solicitation number just to make things more intuitive as you look these up. In terms of the funding, you can basically ask for up to $300,000 in direct costs for a period up to 3 years. And the reason that I emphasize that direct element is that with NIH funding, many of their opportunities divide the sections of the budget to direct and indirect costs. So direct costs are anything having to do with the project itself, and indirect costs basically help you with all of the administrative aspects related to the project, which is wonderful. If you are a non-US company, the indirect cost is usually up to 8% on top of the budget. And if we're talking about a US company, it's usually 30 to 40% standard. It can be much higher, but you'll be You obviously have to justify it, and that's definitely a different stage. We will not be going into that in this presentation. So basically, if we'll total the award, so both components together can get up to $1.2 million, which is obviously not that bad. In terms of the scope, so they aim to develop new and improved therapies to treat and or prevent injuries resulting from chemical threats. In terms of the supported activities, confirmation of molecular targets, demonstration of in vitro activity, preliminary in vivo efficacy, preliminary ADME or tox evaluation, and PK/PD data. The next deadline is, well, it's actually not September 11th. The next one is May 14th, but it's definitely a bit too close. So the next realistic one is September 11th. And the second one is another another opportunity, countermeasures against chemical threats, and again, CounterACT, optimization of therapeutic lead compounds. This is a UO1 as well. You have the solicitation numbers. And here the budget's not capped. You can ask for funding for up to 5 years. And although there's no official cap, we definitely recommend not going over $2.5 million without getting their approval. And this is something that is typically done before submitting, making sure that you are reaching out to the program officers. They are incredibly helpful. They'll be very happy to make sure that you're submitting something that's compliant. So reach out to them. In terms of the scope, the supported activities for this opportunity is GLP IND enabling safety studies and pivotal efficacy studies in animals, cGMP production, and human safety clinical trials. Another element worth mentioning here is that these applications are also viewed by BARDA as a very important stepping stone towards receiving a BARDA support. And we'll talk about BARDA in a minute, but the take-home message here is that all of these agencies, although they seem separate, they make sure that they do talk, and getting a grant from one of them is usually very helpful in terms of getting other grants from different agencies in the future. So that's definitely something to bear in mind. Again, deadline September 11th, 2018. And in terms of the clinical stage funding with the NIH again, they have, NIAID specifically, has a clinical trial planning grant. If you'll think about these agencies, their goal eventually is to help you get funding and help you do the research that you would like to do. So even before you're going into the clinical trial, they'll give you a grant to help you plan it. They'll give you up to $200,000 with the purpose of basically helping you find your team and your site and the collaborations that you need to do, and the advisors and the study design and protocols and development, and basically make sure that you're ready to go in terms of having a good clinical trial that will be successful. The next deadline for that is September 14th. And we find that it's easier to get a clinical grant, a big clinical grant, once you've completed this grant. So definitely make sure that you're looking into that. And obviously the one after that is the clinical trial itself. This is the NIAID's Clinical Trial Implementation Cooperative Agreement, or a UO1. You have the solicitation number. Here, there is no budget cap. And unlike the other opportunity that I showed you before that had no budget cap, but technically without getting their approval, there kind of is. So here, basically everything goes as long as you're able to justify a good scientific plan. The projects usually last up to 5 years. And in terms of the scope, basically they say that they will accept applications for implementation of investigator-initiated high-risk clinical trials and mechanistic studies associated with high-risk clinical trials. It is important to note that this is definitely a high risk, and you know, they said it quite a few times in the paragraph that I just read to you. But there is an equivalent, an R01 equivalent for low risk trials, so definitely look that up as well. So that's that. The deadline is September 13th. And in terms of the NIH review process, that is definitely something important to mention at this point. You can definitely look at it as a scientific review process, but a more accurate way to look at these applications and to look at these review boards is a risk assessment process. So as any investor, they will have to make sure that the strength of the application is more significant than the risk of supporting it. Even with the high-risk ones, high-risk opportunities, you have to make sure that you are compliant with what they want to see. And in terms of what they're looking for, as they basically give you a score and as they review the application, they have 5 review criteria. So the first one, the most important one, is the scientific approach. What do you plan on doing with the grant that you'll be receiving? You'll have to describe the different the different experiments, the different rationales behind it. You need to have a very significant research that you're describing to them. And another very important element is not just being able to present a good problem and a good solution. You need to have a very innovative way of doing it. They want to make sure that they are supporting cutting-edge science. So both the approach, the significance, and the innovation are the most important elements of the application review process. The fourth review criteria that they have is the leadership of the team. Who will be managing the grant? You need to make sure that the person in charge will have the capacity, the experience to really see this project through. Because even if you have a very good idea and a very good method of basically making sure that this idea comes to life, if you don't have the right people behind the grant and behind the project, it'll probably not be successful. So if you need to have collaborations, if you need to have people advising you from outside the company, definitely make sure that they are included in the grant. If, just as an example, you're doing some kind of kidney project and you have no one in your team that is an expert within kidney-related diseases, it will not look very good. And the final one is environment. Make sure that the project is conducted in the most appropriate setting. If you're doing a microscopy-based project and you do not have a microscope, obviously it will be problematic for the reviewers. So these are the 5 review criteria of the NIH. I would like to take a short break from the NIH and talk a bit about BARDA, the Biomedical Advanced Research and Development Authority. And that is definitely an agency that is important for anyone dealing with infectious diseases and doing anything related to biodefense. So BARDA's budget is a little over $1 billion. And basically, the idea is to develop and procure medical countermeasures that address chemical, biological, radiological, and nuclear accidents, incidents, and attacks, pandemic influenza, and emerging infectious diseases. So the sweet spot of BARDA, so to say, is to basically help you breach over the valley of death and help the project that you're planning and the research that you're doing basically continue from the early preclinical or early clinical stages all the way up to licensing and hopefully having a cure that is within the market. The grants that they give are not small at all, and they are definitely looking for high risk, amazing work to support. In terms of the review process with BARDA, there are actually quite a few stages. The first part is the white paper. Basically, a very short summary of what you plan on doing. You send that over to them. It is reviewed, and then if they are interested, you're invited to submit the full application. After that application, the application is reviewed again, and that's a more technical review because obviously it has more technical details. After the second review process, you go into something called the negotiation stage, where they basically question the budget and some of the choices that you made, and you know they have some pretty elaborate discussions. And after that, if all goes well, you get the award. But the most important element of the submission is the white paper. And typically we're talking about 5 to 10 pages of that document. And it is important to note that most applications don't make it past the white paper stage. To mean, if you are called to submit the full application, your chances increase dramatically. And obviously, as a result, you have to very, very carefully craft your white paper, ensuring that the science is well presented and represented and meets the guidelines and specifications of the application. And I really can't emphasize this enough. I know that it's not a very long document, but it is critical. And make sure that you're taking it seriously, because basically that's where most of the applications end up. So that's that. In terms of BARDA's solicitations, so they have 3 open solicitations, but we'll focus on one of them. That is basically the broad agency announcement for the advanced research and development of chemical, biological, radiological, and nuclear medical countermeasures for BARDA. There is definitely no budget cap and an extremely high funding levels that are possible. And by very high, I can tell you that it's not rare to see awards that are over $100 million, and definitely companies are able to fund a lot of their advanced stage clinical trials through BARDA. In terms of their scope, they're looking for clinical development of vaccines, antitoxins, and therapeutic proteins, antimicrobial therapeutics, radiological or nuclear threat medical countermeasures, chemical threat medical countermeasures, and clinical diagnostics. In terms of the deadline with BARDA, it's not a dated deadline as we saw before, but a rolling deadline, meaning you can submit the pre-application as you're ready, and then they'll review it and hopefully invite you to submit the full thing. So definitely, whenever you're ready, they are ready as well. Another program within BARDA is called CARB-X, and basically the idea behind this program is to help fund earlier stage projects, even preclinical stage projects. It is done with the collaboration of the Wellcome Trust and the NIH and the AMR Center. And basically, the idea is to help you get that push before you get into the clinical stage part of the process. So definitely, even if you are not within the clinical stage, look up CARB-X and see whether or not it makes sense to submit. Another agency worth mentioning is the Department of Defense, or the DoD. They have quite a few programs within the DoD. First of all, they have DARPA, the Defense Advanced Research Projects Agency. They have DTRA, the Defense Threat Reduction Agency, and they have USAMRMC, which is the U.S. Army Medical Research and Material Command. And I would like for us to talk about quite a few of these. So let's start with DTRA, the Defense Threat Reduction Agency. Basically, they're looking for chemical and biological technologies. And I added the solicitation number. In terms of their funding, there is no budget cap, but make sure that you are able to justify the amount of money that you're asking for. Their scope is very wide as well. I'll just mention a few of these. So first of all, detection of chemical and biological information systems with the capability development, protection, identification, and collective hazard migration, threat agent science, and the list goes on and on and on. The deadline here is rolling as well. So again, submit when you're ready. And moving up to the United States Army Medical Research and Material Command, or USAMRMC. Again here, no budget cap. Their scope is also wide as well. Basically, they want to provide solutions for medical problems of importance to the American war fighter, military infectious diseases, combat casualty care, military operational medicine, clinical and rehabilitative medicine, military biological defense, medical chemical defense, medical simulation, and information science as well. Last but not least, DARPA, Defense Advanced Research Project Agency. In terms of their projects, it's usually up to $750,000. Their scope basically is to leverage biology as a technology to solve interactable problems, seeks to leverage advantage in engineering and computer science to drive and reshape biotechnology for national security, interacted in a range of emerging technical areas, including human and machine interfaces, human performance, infectious diseases, and synthetic biology. And basically the goal is to develop, demonstrate, and transition biology-based technologies as a part of the national security toolkit. Their deadline is rolling as well, and definitely submit when you're ready. In terms of using non-dilutive funding as a part of your company's plan, we definitely advocate a balanced campaign, making sure that you are including non-dilutive funding as a part of your funding strategy. Obviously, we do not recommend forgetting about all different and other types of funding that you typically go after, or the more traditional ones. But we definitely think that if you are within the scope, you just cannot miss out on the amounts of dollars out there from these non-dilutive funding sources. Everything is with no matching costs, and it's usually equity free. So definitely look these things up. In terms of tips to maximize your chances of being awarded, the first thing you have to do is lower the risk for the funding agencies. You have to know your weaknesses. You have to talk about them. Don't try and smooth things over, because the people reviewing the applications will be able to tell. You have to make sure that you're finding the right partners if necessary. Again, if you have everything within your team, you're good to go. But more often than not, it does make sense to make sure that you have collaborations with people that could help you basically see the project through. You have to know the interests of the agency or the mechanism that you're going after. You can find these things online. It's definitely something that they try and make as available as possible, because their goal is to fund specific projects. And I'm sure they don't want you to waste their time and your time, obviously, preparing something that they will not be able to fund. you have to make sure that you are addressing the non-important admin parts. And, you know, we write non-important, but obviously they are critical. One of the worst things that can happen to you, and I say this after writing many applications myself, is to prepare an application and then see that you're missing out on a form, or that there is a specific box to check that you did not check, and then the application is not reviewed at all. And that could be incredibly frustrating. And you also have to establish yourself both as a top researcher and an experienced manager. Again, they want to make sure that as they award you, you will be able to see the project through. In terms of, you know, the type of work that we do, or I want to say the method that we found the most effective, is to first identify all of the relevant funding opportunities. I mentioned a few agencies just now, but obviously there are other ones. Look up private foundations. Make sure that you are doing a very good, you know, investigative work before you even begin writing, to make sure that you are investing your time in the most appropriate set of opportunities. And second thing we do is definitely make sure that you're creating multiple applications. Basically, make sure that you do have a long-term plan. These things are available throughout the year. Make sure that you're planning your time correctly. And obviously, try and submit as many top quality applications as you can. It does not make sense to submit an application that you know, is not competitive. I know we talked about very high chances of success with, with NIAID, for example. But again, an opportunity and an application, that is not compliant with what they want to do will just not be awarded. So definitely make sure that you are taking that into account. Another very important element as a top quality application is to understand that a grant is not a scientific document in a way. Obviously, you need amazing science, but you also have to think about how you're presenting that science to the people reading it. If it's not clear, if they're not able to see why your idea is amazing, the application will probably not be awarded. So you have to make sure that it reads well. So that's what I have for now. Thank you so much for taking the time to speak. If you have any additional questions, feel free to shoot me an email or call. In terms of the next webinar that we have, it will be on May 29th, and it will be on the Congressionally Directed Medical Research Programs, another DoD program that we're big fans of. We work a lot with, and I will send you a link through the chat in a minute. There, you all have it. And thank you so much. And I see that I have quite a few questions here. So first of all, if anyone else has questions, please feel free to write them in the chat. Okay, let me see. Okay, first question, can you submit these applications without a collaboration from an academic institute? Yes, you can, absolutely. I know I mentioned that you need to have collaborations when needed, but again, if you have all of the expertise in-house, it doesn't make sense for you to go out if you have everything. You can submit as a small company. You can submit as a very small company. I can tell you that we were able to win awards with very, very early stage companies. And the most important element is definitely the science. And that goes out to another person who asked me, John, who asked me about virtual companies. Absolutely. Virtual companies can also win. And this is definitely not something that should stop a small company from submitting. Even if you're completely virtual, it still works. If you are the team and you're the brains behind the project, just make sure that you're submitting. Okay, and I'll just take one more because that's all the time we have. So Vanessa asks about non-US companies, and she says that she is Canadian. So definitely non-US companies can definitely submit and they can definitely win. I can tell you that our largest award last year was actually not with an American company. So if you do have good science, they'll be very happy to support you. And obviously, if any other questions arise, please feel free to email me and use the slide deck. It's in the handout section of the chat. I'll also email it as we're done here. And thank you so much for joining in. And we'll see you on our next webinar. Thank you.